everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host of the Dean's Chat podcast. Today, I'm joined by 4 of my students from the Arizona College of Podiatric Medicine. All 4 are second-year students, and they're in the class of 2026. I'd like to introduce each of them individually. Layla Galavotti.
Hi, Dr. Jensen. Thank you for having me.
Well, thank you for being here. And Landry Batis.
Hi, Dr. Jensen. Thanks for having me.
Thanks for being here. DeCleene.
Hi, Dr. Jensen. It's great to be here.
Thank you for coming down. And Clayton Winn.
Hi, thanks for having me.
Well, I'm glad all 4 of you could make it. It's like 2 weeks before Christmas, and the month is winding down, and I'm glad you could make time before heading back to your homes for the holidays.
Of course, we wouldn't miss it.
That's great. Well, welcome to Dean's Chat. So one of the things I'd like to do is I'd like to take this group of 4 representing the class of 2026 and get together quarterly until you graduate. And I think that would be a lot of fun because our listeners could follow your academic journey. And I know you've got boards coming up in about 6 months. And then you'll get into clinical rotations in the 3rd year and clerkships in the 4th year. And during the 4th year, you're also taking boards part 2 and interviewing for residency opportunities. And then the match is in March. So I think that following longitudinally your journey would be really fun for our listeners and viewers. So thank you so much for joining me.
Sounds awesome.
Yeah,
Excited.
absolutely.
Great. Well, what I'd like to do is introduce you to our viewers and listeners. And I was wondering if each of you could kind of give your podiatry journey to date, namely where you're from, where you went to undergrad, and how you found out about podiatric medicine. Allie, would you like to start?
Yeah. So I am from Okoboji, Iowa. I went to undergrad at the College of St. Scholastica in Duluth, Minnesota. And I majored in biology and minored in gerontology. And originally I was thinking PA for like a long time. And then I got a job at the nursing home and I really loved that. And decided I didn't want to do PA. So I was like, okay, well, I got to figure it out. And Okoboji is a pretty small town and the hospital there is really small. So they were super great about letting me job shadow. So I job shadowed a bunch of different like medical professions, like oncology, home health nurse, like anything you can think of, I watched it. And I job shadowed a podiatrist, and I just absolutely love the work-life balance and the versatility of just being able to like pick and choose what you really want to like specialize in. And being from a small town too, he saw a lot of the same patients like multiple times, especially his diabetic patients. And I really liked the patient interaction, just getting to know your patients as well.
Fantastic.
Yeah.
Clayton, would you share your story?
Yeah, so I'm from Ogden, Utah. It's a small little town a little bit north of Salt Lake City. I went to a school called Weber State University. A lot of people know that's where Damian Lillard went to school. That's where he played basketball. And I always wanted to go into medicine. I just didn't know what kind of medicine I wanted to go into. And then while I was there, I had this cool opportunity to be a anatomy instructor, just for like the undergrad anatomy class. And so they had us do all the dissections for the cadavers that they'd use, and then we'd teach the lab portions for all the undergrad students. And so that was a lot of fun, and that's where I realized I specifically kind of wanted to do more surgical type specialty. And I still just didn't know what I wanted to do quite yet. And that's when I kind of heard about podiatry at that point. And then my grandfather, he had some like diabetic ulcers and stuff like that. And so I took him in to go to see the podiatrist, and I was like, oh, this is actually really cool. And the rest is history kind of a thing. That's kind of how I planned my schedule. And here I am today. So, yeah.
Well, thank you. I'm glad you're here.
Yeah, it's good being here. It's been a really, like, honestly, I feel like I didn't really know too much about it at the beginning. And the more I learned, the more I like about it. So
that's great. Layla, would you share your journey in podiatric medicine?
Yeah, so I am from Hamden, Massachusetts. It's a small town outside of Springfield, and I went to Sacred Heart University, a small school in southern Connecticut. So it's a bit a ways away from where we are in Arizona, but that's the best part. I got to see the other side of the country by going to school over here. I have an interesting way that I got into podiatry. My mom is a podiatrist. However, I didn't always want to do podiatry. I was similar to Allie's story of shadowing a lot of professions. And I hurt my knee in high school. I did ACL, MCL, meniscus, and I always thought I wanted to be a physical therapist after that. So after shadowing and doing the PA, the MD, the DO, and then I shadowed my mom and other podiatrists, I realized that I really have an inkling or a interest in lower extremities, especially with my knee injury as well. So that's kind of where I come from, and my mom's been very helpful, and it's she always told me you can do whatever you want, but she is glad that I'm following in her footsteps, if no pun intended.
Your mom and I knew each other in San Francisco. We were
Yes.
going to school at the same time.
Yes.
So, very good. Landry, can you share your story with us?
Yeah, so my name's Landry Batis. I'm from a little town in Meridian, Idaho, Potatoeville. And I also went to Weber State with Clayton. I majored in zoology and chemistry. And kind of interesting, I remember sitting in a class where they were telling us like what we could do with the zoology major. And it was like, oh, you could be like a zookeeper, or you can be like game management. And I was like, oh man, those don't interest me a ton, but I knew I wanted to do medicine. So I took the MCAT, and my parents have a cabin in Island Park, and I was bored there one time. So I popped on Facebook Marketplace, and a guy was like, hey, I need help fixing my roof. So I told him I'd go help him. So I went over, met this random guy. It was a nice cabin. He was really nice. And I was like, hey, I just got to ask you, what do you do for a living? This is an awesome cabin. You seem like you're doing pretty well for yourself. And he told me podiatry, and I had never heard about it. So he told me, he said, well, you know, if you end up not wanting to go the DO or MD route, you should seriously look into podiatry. It's an awesome profession. So long story short, I applied to all the DO schools, and I got actually denied by Des Moines, but they reached out to me and said, hey, you should look into our podiatry program. And it clicked that Dr. James was his name, told me about, and his son actually went to Midwestern, told me about it. So I ended up shadowing him and was like, hey, this is exactly what I want to do. And ended up applying to podiatry school, and it's history. We're here. I'm excited.
That's great. So let me ask you a question about shadowing. Shadowing seems to be a common theme for students. Once they understand what podiatric medicine's about and they get a chance to shadow, that kind of seals the deal in our profession. Allie, what was it about your shadowing experience that you really enjoyed?
Yeah, so I shadowed Dr. Blankers in Okoboji, Iowa, and he is just like super nice guy. He was really good at teaching, and he was really receptive to a lot of questions. But I just thought it was a really great opportunity to see what a whole day would look like as a podiatrist. And I shadowed him for like a few days back to back, and that was also really helpful. And I had the opportunity to go into the OR with him, and just being able to see the surgical side of it too was really awesome. And yeah, he just was really happy with his life as well. He got to coach his sons in baseball, and so just the like that work-life balance, he was able to kind of do it all, and I really, really liked that.
That makes sense. Clayton, how about your shadowing opportunity?
Yeah, so I had like an interesting, like I could not find anybody that would let me shadow them. It was kind of like during the COVID time, and there was like rules like kind of preventing like students following along. They wanted to limit like how many people were in the room and stuff. And so I knew another doctor, and he worked with the podiatrist, and that guy's name was Dr. Gary Oakes, and he was amazing. He let me, for however reason that he got me in, let me shadow him for a few days, and he wouldn't let me go to the OR. Unfortunately, he like kept that to himself. He was pretty stingent on everything, which was good. And he kind of showed me like how his life was, and like what his daily clinic experiences were. And I really liked it because his patients just loved him, because it was like really cool to see how you can really just like fix some simple problems like within a day, you know, and they can like walk away and they're a lot happier then. And so it was a really good opportunity. And yeah, anyways, that was honestly a big push for me, like being like, yep, I'm going to do this. Because a lot of it was research online about podiatry, and I still wasn't sure. And then seeing him doing what he does, I was like, okay, let's do this. So
yeah, those COVID days were a challenge to find, you know, clinical opportunities to shadow because there was such limitation.
Yeah.
So,
yeah.
Well, I'm glad you did. So you grew up podiatry, Layla, so you knew what you were getting into.
Yes, I did. I did shadow my mom a few times, and like Clayton said, when you know that they have the good work-life balance. It's an attractant to want to pursue that, because and when I would shadow her, the patients wouldn't just say your mom's great just because I'm there. I know that they would say that if I wasn't there. So it's nice to have a role model like that. But I also shadowed when I was in college, Dr. Jesse Parks, and I got to go into the OR and see a bunionectomy, and that was really cool. And just seeing how I got to see a day in his life as well. And someone that's not my mom it was just no bias or anything like that. So that was also, I was really appreciative to do that when I was in college. And it just, I admire the medical field, the podiatrists, everything that they do to make people's lives easier is just, that's why I wanted to do it. And it's a great profession that I think doesn't get enough credit.
Yep, there you go.
Yeah.
Landry, how about your shadowing experience?
Yeah, so I kind of same as Clayton. I was trying to meander through the COVID era, but I was able to get on first with the pathologist. And actually, I shadowed 2 different pathologists because that's what I thought I wanted to do. And I remember one time I was sitting in the office with him, and we were looking at a biopsy of something. And he was like, "Oh, this is awesome. And I was like, "Oh, what am I looking at?" Because I didn't know what a histoslide looked like. Like, "Oh, this is like what stage 3 cancer would look like." I remember thinking, I was like, man, that's kind of a bummer. We appreciate what they do, but I just thought, I don't know if that's what I could do, get excited about diagnosing people with late stage diseases. So that kind of threw me for a loop. And then the Dr. James, when I kind of already talked about him, when I wanted to know about podiatry, I went and shadowed him, and it was night and day difference. I was there, and he has his own surgery clinic at his office. So all day I just sat there, and we did bunionectomies, we did plantar fasciitis surgery, different things like that. And I just remember leaving thinking that this is exactly what I want to do. It was, for me, it's what sold me on podiatry was that opportunity.
Good. I think one of the reasons so many students visit podiatric physicians and come back feeling like it's a great profession is because most podiatrists cater their practice to what they like to do. And if you're doing what you like to do, that's what we're all looking for, right? So it makes a lot of sense. So kind of a self-serving question here, but why did you choose the Arizona College of Podiatric Medicine, Layla?
Oh, I'd love to start. Being from the East Coast, there are some schools closer, and I just couldn't find, I only applied to 2 schools, actually, including Arizona. I applied to Barry as well, which would still be a 3-hour plane ride for me. But Arizona just, after the interview, my story's a little funny. I did a virtual interview because it was COVID, and my dad and I were like, he was like, "Do you really want to go? You really want to go far away?" And I said, "Oh, I don't know. It could be a good opportunity. I'm an only child." So my dad's kind of like, "You should stay close." So, but after my interview, I was so glad that I did do the interview because I loved it. And it was a virtual interview, and you didn't even, so it was the people that sold me. And so I was just so grateful to, and then I got to tour, and you actually were so kind to show my mom and I around, and we got to have a good experience. And the weather, you can't beat it when it's right now in the winter on the East Coast. It's different. So I was sold on just the people, especially the professors that interviewed me. It was Dr. Joseph and Dr. Jenkins, and they just made me feel like even though I was from far away, because I was nervous that I was going to be the only one that was from far away, and that's so untrue. And everyone has been open arms and welcoming. So my advice is, if you want to do it. So.
Absolutely. Thank you. Allie, why did you choose the Arizona College of Podiatric Medicine?
Yeah, so at first, just looking up all the schools, I really loved how it was connected with the DO school. I thought that was really interesting and just a great opportunity just to get that interprofessional connection with the other programs. And then similar to Layla, the interview really sold me. I just felt like all the questions that were asked were very genuine, and everyone really just wanted to get to know you, and it was more of, will you be a good fit here? I didn't feel like I had to pitch myself, and I just really liked that. It just felt very welcoming and very comfortable here.
That's great. Thank you. Clayton?
Yeah. So I applied to all the schools. I didn't really know what I was doing. And I was just like, I just want to get into any one of them. And so I had a few interviews before I had my interview at in Arizona. And they were all good and stuff. And some of them I got grilled on a little bit, which, I was kind of expecting, like, oh, what about this MCAT score for your reading? It's like, oh, that was my low side, I guess. But anyways, and then I was in the interview with you, Dr. Jensen, actually. I don't think I've told you this, but I was just in that, and we were just talking, and it was really good. It wasn't like, it was just, like, I think, Al, you said it really well. It was more about getting to know me. Is this going to be a good fit? Like, are you going to be a good fit for like being a podiatrist and stuff like that? I really liked that. And my wife really wanted me to go to Arizona because she has family out here. And so that was like a big pull. But I was just like, the one time I'd been out here was really hot. And I was like, I don't know if I want to go out to Arizona. I want to go out, somewhere else and get further away from Utah, maybe like go live further away and try that out. But in that interview, I just like not to get spiritual. I just felt like very much like I was like, I knew I was going to get accepted in, and I knew this is the school I needed to go to. And I'm really, really glad I made that choice, and that I kind of followed that prompting and stuff, because it's been a good choice. And I also like the combination of being with a DO program. I think that really sets us apart in a sense too.
Very good. Thank you. Landry, why did you choose the Arizona College of Podiatric Medicine?
Yeah, kind of similar to what everybody's been saying here. I did the same thing as Clayton. I just applied to all the schools because wasn't quite sure how I was going to go, but I knew I wanted to get. I would have loved to have had a DO background, so I was more between Midwestern and Des Moines. And we actually flew out here. I did the interview virtually and had a great experience. Love the professors. Dr. Jenkins was on mine too. You were on there. Had a great experience on there, and we decided, let's go look at the campus. And we did a tour around the campus, and my wife was like, you can drop the other schools. Let's go here. And that was after I'd been accepted, but it was kind of in that little waiting time. So we came, and this was actually the only school I ended up interviewing with, because my wife was like, this feels like home. So
that's great. You all know this, but we don't give interviews unless you've got the academic wherewithal to be successful here, so that when we do the interviews, I'm not asking you about the Krebs cycle or anything. I'm trying to get fit, right? We're trying to bring leaders into our school that are going to be leaders in the future. And so we're all excited that you all decided to come to Arizona. So thank you. So let's get into the academics a little bit. So when you showed up on campus about a year and a half ago, what was it like that first few weeks? Because it's fast and furious, right? Also anatomy and biochemistry. Was your first year harder or easier than you thought it was going to be? Clayton?
I thought it was harder than I was expecting, for sure. Like, they really kind of throw you in the fire, like it's go, go, go from the day one. I think you have an anatomy test that first Monday coming in, if I'm not mistaken. And so it's like, you're really going for it. And so, I don't know why, you always hear, whenever you hear about medical school or podiatry school, you always hear it's oh, it's difficult. It's going to be one of the hardest things you'll ever do. And I was just thinking maybe it's just an exaggeration. It can't be that bad. I don't know why I was doubting these people. I don't know why, but it's difficult. It's not easy. And I like to say it's anybody can do it. I really do believe anybody could do it if they put their mind to it and their heart into it, but it's not for the faint of heart. It takes a lot of time and a lot of studying, and but it's worth it. It's good. Yeah.
What was the hardest class for you so far?
I would say, obviously, I think Path is obviously the go-to answer, but other than that, the one that I think surprised me being the hardest was physiology for me. I don't know why that one was just difficult. Biochemistry and anatomy weren't that bad for me. I really liked the anatomy. I liked the biochemistry, and physiology. It's not that I didn't enjoy it. It was a struggle for me, and then my favorite class, honestly, which is funny, is for the basic sciences, I should say, is it's been pathology. It's been really cool to kind of learn how the body works and how medicine fixes it, and I've really enjoyed that. But that's kind of I wouldn't say that's my favorite class in the world. I think my favorite one that we've taken was the lower extremity anatomy. was a lot of fun. Being able to learn like the minutia of everything, within the lower extremity.
We'll circle around and talk about that more. But Landry, your experience first year, was it harder or easier? And then comment on a couple classes.
Oh, it was way harder than I had expected. I kind of coasted through undergrad, so that first week was tough. And like all my friends had told me, that's classic. It's like drinking water from a fire hose. But man, it really did smack me that first week. And I remember going home to my wife and being like, well, I swear I just learned my whole undergrad in like 3 hours of classwork. And like Clayton said, that first test was that Monday, and I went into it like, oh, it can't be that bad. And it definitely got me. But it's gotten better, and it's still hard, but at least now I kind of understand how to maneuver through medical school. But it was definitely tough.
What class has been the hardest for you?
I got to go with Clayton. Path is tough. Phys for me also is probably a close second, just because I don't know what it is, but the heart and all the intricacies of it, I struggled with, but Path takes the cake.
How about your favorite course?
Favorite course probably has to be, it's actually like a half credit course that I think it's really cool that Midwestern does that I didn't know about, but we basically take a course where we go and shadow different doctors, and we go to the homeless clinic and stuff, and you do more hands-on, and that has been a really awesome experience because it kind of emphasizes why I'm here instead of just like going to class every day and be like, oh man, why am I here studying paths?
Right. No, I hear you. Layla, what's your experience been so far?
So my experience has been great. First year was tough. I think that agreeing with them that it's what I have to say is like, if I knew how to study, I think first year would have at least, especially fall quarter and winter quarter. I think spring was where I kind of was like, you know how to do this. And now second year, even though the classes are more challenging, I know how I study and how I can get the grades that I want to get. And thankfully, and I think that first year, like Landry said, it's a lot. And when you do well in undergrad, like all of us wouldn't be here if we didn't. It's kind of a humbling moment when you get your grade back and it's not what you expected, or you've never gotten a grade that low. And you pull yourself up because you have to. You have a test the next week. So it's like I've learned a lot about myself as a student first year. I'm very lucky to have Allie, who I study with, and we've worked out a good habit of getting there and doing well. And so it was tough. It was definitely a humbling experience. My least favorite class would be, I think, I don't have. It's like Landry and Clayton said, pathology is the easy answer to say because it's difficult material. But if I think anatomy first year, if I knew, because I took anatomy during COVID, so it was virtual online, because for medical school, you don't have to necessarily take anatomy. So I kind of pushed it. And I think that was hard for me. Like cadaver lab was so different. I've never done that before. So that was a different, and I think I struggled in that, but then I found my way. So pathology this year takes the cake, but I think I could have done better in anatomy last year if I knew how to study. And then favorite class, I'm different. I liked biochem for basic sciences. I don't think if you asked me that in college, I would never have said that answer, but I did really well, and I figured out how to study. For podiatry, I really liked Pod Surge 1, the spring class that we took. We got to do some hands-on suturing, which I thought was really interesting because I've only been able to cut sutures at my medical assistant job and not ever try to do suturing and learn suturing. And then we actually got to do injection lab, which I've never done an injection on someone else that trusted me. And that was really interesting and cool.
Oh, very good. So Allie, what was your experience coming in for that first year?
Yeah, I definitely agree with everyone, especially fall quarter first year. I just didn't really know how to study. My study habits that I did in undergrad just weren't cutting it. And it was just a really big learning curve. But once you figure out how to study and what works for you, it definitely got a lot better. And so it was I think the adaptation to just the different schedule and the different amount of workload and how many lectures you have in a week. You're in class a long time. So I think once you just adjust to that and kind of get used to it, definitely the material doesn't get any easier, but you just learn to handle it better. What
was your hardest class?
I think for me, the hardest class has been pharmacology. I really actually am similar to Clayton. I really enjoy pathology, and I feel like my brain kind of works a little bit more that way of just knowing the anatomy and then figuring out what could go wrong. But pharmacology has been tough.
What's your favorite course so far?
I would have to agree with Clayton that my favorite course so far has been the lower extremity anatomy. I really loved being able to do the dissection in the summer and just kind of have it all come together and just go over it again, because we learned it in the basic skills anatomy course, but going through it so much more in depth and just really learning every single bit of it was I really liked, because it just made it all come together and made a lot of sense.
Very good. Well, I think you will all benefit from having that lower extremity anatomy dissection lab, because every year our students just score very, very high in Boards Part 1 on the anatomy and lower anatomy section. So it'll serve you well going forward. You know, it's interesting. Maybe we dive into this a little bit. Everybody says it's so hard to start, and once you learn how to study, it becomes easier. What do you mean by learn how to study? And I understand everybody studies differently. They study different ways. But I was curious as to what works for each of you. Landry, if you wouldn't mind starting.
Yeah. So when I first came in, like I said, in the undergrad, I had no idea how to study. I'd maybe a few hours before a test, look at my notes and go in and hope for the best. But obviously that doesn't work. So I tried many different ways of how to study, because everybody's got something that works for them. Ultimately, what I found, one of my buddies, Jacob Hoffman, does really well, and I knew he did well. I was like, okay, I give up. How do you study? And he turned me onto the Anki method, and that has been, it's really time consuming. It takes a lot of time because I make all my own decks. I take the PowerPoints and basically put them in Anki, and then I block out the parts that I think are important. And that's been what's helped me.
Fantastic. Layla?
I am a group studier, actually one other person study, and she's sitting next to me. So Allie and I study every test together, and we find that it works well for us. We talk through the lectures. We go through them about 4 times, I would say. And we quiz each other, and that's what works for us. And I don't think since first year fall, we haven't not studied together. And there was only one exception when I had to go home for medical, or my grandpa passed away. So it was just a family emergency. And then she still did well on the exam. So it just goes to show, if it works for you, it works for you. And if it doesn't, it doesn't. So you just have to, you find that. And that's the best part.
Very good. Allie, do you have any secret tips that you can share with everybody?
Yeah, I think with studying with another person, what's so beneficial about it, for me at least, is being able to hear it get explained to me in a different way. Layla explains it differently than the professor would. But then also getting the opportunity to explain it to her and really test your knowledge on if you know it. I would say aside from that, I like to make outlines and just keep them pretty basic and just more of what fits in what category. And I think that really helps me to, even when I'm in the test looking at a question, okay, what lecture is this even on? And that was a really big game changer for me. It's just doing the outline. It kind of keeps it organized in my head, and then I don't freak out or anything if I see it and I'm where did this come from in the exam? So that's been really beneficial as well.
Very good. And Clayton?
Yeah, no, I think I agree, honestly, with what everybody said. I think that's what you have to do. I feel like I know there's people who don't do this for sure, but I think you need to have either some sort of group or somebody to keep you accountable with everything. I kind of do, I'm like a little bit of Anki. So I'm like, people that are deep in Anki, like they hate people like me because I kind of use it supplementally. But I really like it. But I think something that I learned from like first year going into like within the first few tests is you just really have to know it in and out. You know, you can't kind of like, oh, like I know the name, I know kind of like what it does. I mean, it's like, I'll figure it out. That's like the famous last words before going into a test. You can't do that. You really need to know it through and through. So that's what I do. And I think a lot of repetition for me is like the key. Like, I feel like I have like a thick skull. Like I need to like repeat over and over again before it finally sits and plants in there permanently. So anyways, yeah, that's kind of like my study ways. And then I usually always study at the library too. I feel like going to the library is helpful for me because it eliminates a lot of the distractions from studying at home. And I know if I'm like at home, like nothing against my wife, but she'll be like, hey, can you help me with this? It's just like things start adding on and, oh, I'm kind of hungry. Maybe I should go grab some food and kind of put it off. And so if I go to the library, I just get it done there. So, yeah.
Very good. I think it's important to remember that what got you here is going to get you through boards, right? So whatever method you studied to be successful in the courses in the last 2 years is probably the method you should study with for boards. Some people make the mistakes of shifting gears, and I think if Anki is the answer, use Anki, right? And if going through your notes and studying together worked for you, keep doing that through boards. We'll get together again before boards to talk about specific preparation and what we've been doing at the college and what you've been doing individually. But I've always told students the best preparation for boards is to do well in your classwork. And I think Midwestern prepares you very, very well in the basic sciences. Let's talk about biomechanics for a second. Thoughts on biomechanics so far? Allie?
Yeah, I really actually enjoyed biomechanics. The first course we had is in the fall or in the winter of first year. Yeah. It's definitely a way of thinking that I never had to do before. I took physics during COVID, so that was kind of like, didn't really kind of just cruise through it, didn't really totally get in depth and understand it. So it was really, biomechanics was really different for me to think about. But then once it all came together, it really made sense. And I think Dr. Toms does a great job, and she's so helpful. And having the lab portion as well and being able to practice it on our partners and doing the different measurements and doing the OSCEs and performing those with a professor, I think was really helpful as well.
Very good. Clayton, your thoughts?
Yeah, I really like our biomechanics class. I think initially when I was shadowing Dr. Oakes, that was what he said was like what defines podiatry for us, which I was like really excited going into the class and he'd always like ask me questions about these biomechanics things. He's like, doesn't that make sense? And at the time I was like, I don't even know what you're talking about right now. And so, yeah, it's really good. And I really do agree. I think that's what like, really defines like a lot of what podiatry is we really do know our biomechanics well. And what I've noticed is some of the best surgeons that I've seen is that they're really good with their biomechanics. And so, I agree with Allie. Like, I think Dr. Toms does a good job in preparing us and getting us the information so that we know it, so that when we go out, we can utilize those things that she's taught as well.
Very good. Landry?
Yeah, I mean, I agree 100%. Biomechanics for me was a kind of a tougher pod class to pick up. It reminded me a lot of like OChem because it's three-dimensional. It's not just memorize an anatomical structure. You got to think about how it's going to move. And Dr. Toms did a great job. I remember going to meeting with her and just asking her how to prepare for it. And she did a great job explaining it to me and kind of showed me how to go about doing it. And then Dr. Lee, who is an adjunct at the school, he really like motivated me to appreciate biomechanics, kind of like what Clayton said. That's what distinguishes us from the orthopedic surgeons is what we know about biomechanics. And he shows how he uses it on the daily. And now I really enjoy it. I wish I knew more, and I know we're going to continue to learn more about it, but it's an exciting topic.
No doubt. Layla?
Biomechanics is interesting. It was one of the it was a class that really took me out of my comfort zone because it's the first class where you have to do an OSCE, and an OSCE is basically you're going to get 2 random biomechanics exams that you have to perform under 10 minutes, which seems scary, but in the moment, it's not. But it is nerve-wracking. You have to perform them and verbally say what you're doing, and in front of a professor on another student. And it really took me to get the courage and practice and make sure that I understand everything, which is difficult when when it's so foreign to you. And I agree. I think Dr. Toms does a great job. She's like queen of biomechanics, and we're so lucky to have her as a professor. And I know my mom's listening because she always wanted me to go into biomechanics, and she still is like, do you like biomechanics? Because she really enjoys it. So I think that it's a crucial aspect to podiatry, and it's not for everyone doesn't grasp it as quick as other people do, but with the help of the professors here, it's been very helpful, and I know that we'll use it in our future.
Right. A couple notes on that. I think the best way to understand biomechanics is to have a solid foundation in anatomy. And once you know the normal and abnormal functions of the foot, then you can make surgical decisions that are much better. And I think that does separate our profession for sure. You mentioned Dr. Lee. Dr. Lee, myself, your mom, we were all in San Francisco at the California College, which is kind of the home of podiatric biomechanics. And when I listened to Dr. Toms teach, she also went to California. I'm having like flashbacks to just, really understanding the way the foot works throughout the stance phase of gait is so crucial to our ability to relieve pain. And no other profession does it like podiatry. So I think it's just a great addition to the curriculum, and it's something that you'll use throughout your career. So I'm glad you're enjoying it. And it's a challenge, though. It's like speaking a different language sometimes.
And now at the airport, all I do is watch people's gait, and I'm like, you're a little different than what it's so funny because you just notice things that you wouldn't before.
The early heel offs, the abductory twists, absolutely. People think you're strange watching them walk. I did the same thing. We all do the same thing, right? No doubt. So let's shift gears a little bit. You're all studying a lot. You treat your academics like a job. What do you do when you're not studying and embracing podiatric medicine? Clayton.
Yeah, that is a good question because I think sometimes we get really deep into it, and it's good to have some relaxation, to get your brain off of it a little bit. For me, big thing for me is I love spending time with my family. I wish I could be with them more than I am, and so when I get my off time, that's what I really like. I just like spending time with my daughter and my wife, and just hanging out with them, and we like to go out and do hikes and stuff like that. It's too bad because Ivy, my daughter, she's only 2, so we can't do too much craziness with her. But we went out to Sedona recently, and Ivy did the whole hike by herself. It was awesome. We had a blast, and so that's kind of what I like to do. Is I like getting outside, just being out in the fresh air, and spending time with family. Those are my big things I like to do. I don't have very big hobbies yet, but I have big plans once all the school's done, and so yeah.
Ellie, what do you like to do when you're not studying?
Yeah, so I recently got married, and so my husband and I really also like hiking and just getting outside, especially in the winter in Arizona. It's so beautiful this time of year, so we really like hiking. And then in the summer, we go to a rock climbing gym, and that's indoors, and I got really into that this summer, and that was really fun. It was such a good physical and mental challenge because you got to think through routes, so that was really fun. And I also really love painting, so I do a lot of painting when I have time. Yeah. Very
good. Landry, what do you do when you're not studying?
I'm like Clayton. I have a 18-month-old daughter, and she keeps me busy. But I love kind of seeing her grow up and doing stuff with my wife. So we do a lot of that. Full disclosure, though, I have really bad ADD. So I can only sit at home for so long. And my wife always tells me I have too many hobbies. So I golf, hunt, shoot. Midwestern has an intramural program, so I'm doing basketball right now. But I just love working with my hands, love working on the car. Just anything to kind of take me out of the library to work with my hands and stuff I'd like to do.
You're going to have a whole career of working with your hands. Just got to get through the basic science.
Yeah, just got to get through it.
Layla, what do you do when you're not studying?
Unlike my peers, I don't have a husband or kids, but I enjoy spending time with friends, and it's been great making a lot of friends here, especially being away from home. I like to exercise. I like to read, and my apartment complex has a pool, which is nice when the hot weather in the summer. So it's nice that, and also we've done a few like podiatry as a class, like for the 4th of July, we'll go to the pool and do some class bonding. So that's been nice to have people that really support you even when you're not in school. So it's fun to hang out and talk not school things.
Absolutely. Layla, what would you tell a prospective student that is contemplating a career in podiatric medicine?
I would tell them to do it. I have no regrets, and I'm not biased because of my mom. I did this. I try to tell myself I did this because I want to do it, and that's the truth. And she would say the same. So I think that anyone that's contemplating it should do the research, shadow. Make sure you want to do this because it is a lot. But I think it's so worth it in the end, especially when you get that good grade on a test. And we're about to, and like Landry said, we've done some homeless shelter clinics, and we're going to go on rotations and get more experience. It's those things of connecting with the patients that really makes all of this worth it when in the end.
Absolutely. Landry, what would you tell a student that's contemplating a career in podiatric medicine?
Yeah, like Layla said, I would say absolutely do it. Even throughout school, some of the DO kids, once they find out what podiatry is, because a lot of them were like me, they had no idea what it was until it came to them. And man, I would have known about podiatry more. That maybe is something that I would have rather done. But podiatry is awesome. Like you said, for me I love working with my hands. Podiatry, I have that opportunity. I have that guaranteed opportunity to work with my hands and do surgery if I want or whatever I decide to do. But something else that I really like about podiatry, I love business. I'm very business oriented, and podiatry, in my opinion, is a very, in medicine, an easier avenue to get into your own private business or own private practice and run the business side of it. And luckily through Midwestern, we've been able to meet with doctors like Dr. Case, who has been on here, and Dr. Bland and stuff, and kind of show us how like business and podiatry and medicine all works together. And I think that that's pretty unique to podiatry, that you don't have to be tied down to a hospital or a group or anything like that. You have the freedom to do your own thing, or you can do that if that's more what you want.
But that's interesting. A lot of students that are looking at osteopathic medicine or allopathic medicine don't know about podiatric medicine. And when they find out about it and they realize that you know what you're going to be as soon as you go into school, and you know that there's going to be a 3-year surgical residency waiting for you after 4 years, it becomes very attractive. I agree with you. Allie, what would you tell a student that's contemplating a career in podiatric medicine?
Yeah, I agree with what Layla and Landry said as well. Definitely get in and try and shadow. It really is a great opportunity to expose yourself to what a day in the life of a podiatrist would be like. And then I would also say there's so much opportunity in the field of podiatry. It's so versatile. You really can make it whatever you want it to be. And there's an avenue for everyone, and you can really fit it to your life, and you can fit it to what you want to prioritize. And I think that aspect of podiatry is so special. And so I would definitely encourage people to look into that if they're thinking medicine.
Well said. Clayton, I'm going to give you the last word. What would you tell a prospective student who's contemplating a career in podiatric medicine?
Yeah, hopefully this is good stuff here. But I would say when I was an undergrad doing like pre-med, everybody would always be like, oh, should I do pre-med? Should I do pre-med? I'm like, and to me, it was just always like a really easy answer. I'm like, do it. If you want to do it, then do it. If you want to be a doctor, then do it. And it's like, if you want to be a podiatrist, then yes, do podiatry school. And I would say, yeah, it's a really cool field. And I think it's cool how you can really sculpt, like podiatry in itself is actually really broad. So you'd think that, oh, it's kind of like really narrow, but no, there's podiatrists who only do like diabetic stuff. Some podiatrists only do sports medicine things. And so it really is cool. There's so many different paths even within podiatry. So I think the more you learn about podiatry and the more you research about it, the more you really like it. It really is a good career, I think. And I think as like coming from like a family background, I think it's really family friendly too, which is a good plus. So
a lot of students come in thinking this is a great lifestyle, like you saw, right? I always remind them that the lifestyle starts after you do school and after you have residency. So, but it is a phenomenal profession. And I'll tell you what, I wouldn't hesitate. I would do it again in a heartbeat. So, all right. Well, I wanted to thank all four of you for coming down to Scottsdale. It's beautiful. I'm wearing a sweater, but it's really warm out. And what I'd like to do is thank all of our listeners. If you're listening on Apple Podcasts or Spotify or Google, please give us a 5-star rating. And if you're watching on YouTube, please become a subscriber. And how about a cheers? Thanks again, and good luck with your studies the rest of this quarter. Bye-bye, everyone. Thanks,
Thank you.
everyone.
Thank
Bye-bye.
you.
Thanks for coming down.